Bangladesh, a land of tremendous beauty. This riverine country has ample sources of water as well as a high rate of waterborne diseases from ancient ages. At the same time, weak sanitation system was also responsible for making human life difficult. Department of Public Health Engineering under Local Government Division had been working vigorously to change such morbid situation. As a result, Bangladesh has become an example of safe water and sanitation coverage in the eyes of the world. But the way of this achievement was paved with immense hardship. It was 1971.
এবারে সংগ্রাম আমাদের মুক্তির সংগ্রাম এবারে সংগ্রাম স্বাধীনতার সংগ্রাম
Bangladesh gained independence under the valiant leadership of Bangabandhu Sheikh Mujibur Rahman in 1971. Our independence was gained through great sacrifice and brutal war. The planning to build a better nation started under the strong leadership of the father of the nation, Bangabandhu Sheikh Mujibur Rahman. The government of Bangladesh started the rehabilitation and development of the ruined water supply and sanitation system after independence. Now, after 47 years of independence, we can proudly claim that Bangladesh has gained 97% coverage in water supply and almost 100% in sanitation. Safe drinking water and sanitation is a basic human right. DPHE has been working restlessly to serve this human right. Under the direction of the Chief Engineer, through additional Chief Engineers and in the field level Superintendent Engineers have been monitoring 64 districts and all other upazilas to reach the services of DPHE to the root level. DPHE has taken countless undertakings to ensure countrywide supply of safe drinking water and development of sanitation facilities. Earlier, the main sources of water for rural areas were rivers, canals and ponds, which used to get polluted for various reasons. As a result, diarrhea, dysentery typhoid, cholera and such other waterborne diseases caused deaths to many. At the time, child mortality rate was also very high. To eliminate this situation, DPHE started installing hand pump tubewells in 1936 to supply safe water to the rural mass. The department had tremendous success to supply water to post-war rural areas of Bangladesh. In 90s, safe water coverage peaked to 97%, but later on, due to the detection of arsenic in tube wells, the water supply coverage reduced to 74%. To tackle this situation and to supply arsenic-safe drinking water to the mass, different other inventions like deep tube well, dark wells, PSF, rainwater harvester, arsenic iron removal plant, etc. were adopted. And now, with the strong leadership and fervent efforts of the present government, water supply coverage has again increased to 97%. At the same time, to reduce dependency on groundwater sources, excavation and re-excavation of ponds all over the country is underway. With the determination of becoming a middle-income country, the rural areas are being modernized by constructing overhead tanks and supplying safe drinking water using pipelines. Once upon a time, urban water supplies were also dependent on surface water sources. In 1924, Department of Public Health Engineering started its journey as DPHE Bengal by constructing piped water supplies. Before the establishment of WASAs, piped water supply, sewerage and drainage system of Dhaka, Chattogram and other major cities were the responsibility of DPHE. At present, except the WASA zones, Department of Public Health Engineering is ensuring safe water supply in urban areas of the country.
আমরা চাঁদপুরবাসী বহু দিন ধরে আমরা পানির সমস্যায় বিশুদ্ধ পানির সমস্যায় ছিলাম এবং আমি দেখেছি যে আমার দাদি মা আমার চাচিদেরকে কত দূর দূরান্ত থেকে পানি সরবরাহ করতে হয়েছে কিন্তু সেই পানিগুলিও বিশুদ্ধ ছিল না এখন আমরা মনে হয় যেন সেই দিন থেকে অনেক স্বপ্নের দেশে চলে গিয়েছে এখন আমাদেরকে পানি ফুটাতে হয় না এবং আমাদের আগে যেমন পানির মধ্যে বিভিন্ন ধরনের পোকামাকড় পাওয়া যেত, যেটা খুবই অস্বাস্থ্যকর ছিল, সেই ধরনের সমস্যাতে আমরা এখন পড়ছি না। আমরা একেবারেই নিরাপদ এবং বিশুদ্ধ পানি পাচ্ছি এবং নিয়মিত পানি পাচ্ছি, আমাদের পানির কোনো সমস্যা নেই।
Including city corporations, this department constructed pipeline in 159 municipalities to ensure proper supply of safe water. The pipeline water supply scheme is in implementation stage in 55 municipalities and in planning stage in the rest 115 municipalities. As a whole, the coverage for safe drinking water throughout the country was insufficient in 70s. In 80s, it increased to 60%, in 90s to 68%, in 2000 to 76%, and in 2012 to 85%. At present, the percentage has raised to 97%. Safe water has reduced waterborne diseases, child mortality rate, and improved overall living standard. Above all, it has made the society happy and comfortable. Open defecation, hanging latrines, or unhygienic sanitation caused epidemics in the 70s. 98% of the total population used to defecate in open spaces during that time. To improve such unhygienic condition, Department of Public Health and Engineering started providing low-cost sanitary latrines and initiated a new era of sanitation. DPHE encouraged people to use sanitary latrines by selling, constructing and distributing low-cost sanitary latrines in the field level. In addition, sanitation-related plans, rules, regulations and strategies were adopted. To reinforce the sanitation movement, National Sanitation Task Force and Sanitation Secretariat in the central level and Watson committees in the local level was formed. At the end of 2000, the percentage of open defecation reduced to 42% from the staggering height of 98% because of implementing all of these activities, and the number of sanitary latrine users increased to 58%. To retain this success, Department of Public Health Engineering started sanitation movement involving mass people, private organizations and NGOs. Sanitation movement brought about successful sanitation marketing and social movement. As a result, including local government institutions, various private public organizations and development partners helped amplifying countrywide sanitation activities. Now, open defecation in Bangladesh is almost close to zero. Development of total sanitation management not only boosted usage of single sanitary latrines, but also facilitated with community latrines, public toilets, proper drainage system, fecal sludge management, and solid waste management.
আমরা মনে করেন আগে এই বাথরুমের জন্য অসুবিধায় ছিলাম, ছেলেমেয়ে নিয়ে অসুখ বিসুখ বেশি হইতো। এখন আমাকে সরকারি তরফ থেকে এই বাথরুম পাওয়াতে অসুখ বিসুখে বিরত আছি, ছেলেমেয়ে নিয়ে সুখে আছি।
Water is the source of life, but polluted water is the source of diseases. To save lives, we need safe water, not just water. To ensure this water safety, Department of Public Health Engineering established 4 local water laboratories in 1982. At present, it has 15 laboratories, including 1 central laboratory. 28 laboratories are currently under construction. Department of Public Health Engineering has the capacity to examine 53 parameters of water in the Dhaka Central Laboratory and 22 parameters in the local laboratories. Department of Public Health Engineering tests arsenic, iron, manganese and salinity in water using field test kits at Upazila level. This free-of-cost service has ensured safety of drinking water to the marginalized people. Bangladesh is a land of natural calamities. Different natural calamities hit this country all the year round. During that time, water supply and sanitation system breaks down completely. To save lives immediately, DPHE supplies safe drinking water among the people in need, along with water purifying tablets, bleaching powder and hygiene kits. To ensure emergency water supply and sanitation system in the disaster shelters. Temporary tubewells and latrines are also constructed. Department of Public Health Engineering also serves a great deal to battle post-disaster crisis by purifying water, reconstructing water supply, and regenerating the sanitation system as a whole. The department deploys skilled manpower to serve the disaster-stricken people by monitoring through control room at the central level and disaster cell and wash cluster at local level. Department of Public Health Engineering has made exemplary humanitarian stunts by helping out the forcibly displaced Rohingya citizens from Myanmar in the temporary camps. Tube wells have been constructed in the camps to ensure safe water supply. Sanitary latrines and baths for women and children have been constructed for providing better living standard to tormented people. To monitor quality of the supplied water, a laboratory has been set up in Cox's Bazar.
আরা নতুন আইয়ারে গোসল করতে কষ্ট পাই তো তাহলে রাতের মাঝে গোসল করা হয়েছে ফলটিন বেড়ায় গোসল করা হয়েছে হন গোসল খানা ইয়াং গড়িয়ারে বক্ষণে সুন্দরভাবে গোসল আসল গড়ি করে তো
To achieve the Sustainable Development Goal, safe water and durable sanitation have posed as a great challenge for the government. Lowering of the groundwater level, extreme presence of arsenic and salt in drinking water, lack of proper water sources, water pollution, and many other man-made challenges are being efficiently tackled by inventing new technologies.
এই ট্যাঙ্কিটি আমাদের দেশের প্রধানমন্ত্রী শেখ হাসিনা জনস্বাস্থ্য প্রকৌশল অধিদপ্তর থেকে কিন্তু এই পানিটা খাবার আগে আমাদের খুব অসুস্থ বাচ্চা কাচ্চা নিয়ে অসুস্থ থাকতাম এই পানিটা খাবার পর আমরা বাচ্চা কাচ্চা নিয়ে ভালোই আছি অসুখ বিসুখ একটু কম হয়
আগে অনেক কষ্ট আছে পাড়াবাসীরা তারপর বাজার ফানে তারপর আগে জির পানি খালা পানি খাইতে হয় মহিলা তারা বেশি কষ্ট হয় এখন বর্তমানে পাবল হে থেকে সেজ সহযোগিতা পাইছে পাবল হে দিচ্ছে তারপরে দিক পানিগুলা আমগুলা সুস্থভাবে পানি ভালো করে খাইতে পারে
আরোপেন্টের মাধ্যমে আমাদের এই টুঙ্গিপাড়াবাসী অনেক উপকৃত হয়েছে এইখানে প্রচুর পরিমাণে লবণ আয়রন এবং আর্সেনিক মুক্ত থেকে খাবার পানির ভীষণ সমস্যা ছিল এখন মানুষ উপকৃত হয়েছে
আমাদের স্কুল ৯টায় আমাদের স্কুল ছুটি হয় ৪:৩০টায় এর মধ্যে আমাদের পানি খেতে ইচ্ছে করলে আমরা ট্যাপের নিরাপদ পানি খাই এর মধ্যে আমাদের পায়খানা বা পেশাব করতে ইচ্ছে করলে আমরা ওয়াশগুলোতে যাই আমাদের ওয়াশগুলোটা খুব পরিষ্কার এটা আমাদের খুব ভালো লাগে
Safe water supply and sanitation system is a must for maintaining quality living standard as well as quality education, especially for widespreading female education. Department of Public Health Engineering has established water supplies and wash blocks in schools all around the country. Till date, 39,300 safe drinking water sources and 28,500 wash blocks have been provided in primary schools. In the wash blocks, There are separate facilities for female students and teachers and physically challenged individuals. Solar supported tubewells are now being constructed in secondary schools.
ওয়াশ ব্লক তৈরি হওয়ার কারণে আমাদের স্কুলের গুণগত মান বৃদ্ধি পেয়েছে। চতুর্থ পঞ্চম শ্রেণীর অনেক মেয়েরা টয়লেট ব্যবহারের কারণে বাড়ি চলে যেত বা স্কুলে আসতে চাইতো না, তাদের সে বিদ্যালয়ের অনুপস্থিতি কমে গেছে। জনস্বাস্থ্য প্রকৌশল অধিদপ্তরকেও ধন্যবাদ জানাই এরকম একটা সুব্যবস্থা আমাদের বিদ্যালয়ে করে দেওয়ার জন্য।
Department of Public Health Engineering provides special aid by supplying safe water and sanitation in different social, cultural and religious events. DPHE has constructed 31 multi-story toilet buildings, 4,850 ablution compartments, 298 bathrooms and 7-kilometer pipeline for supplying safe water to the religious people gathered for Ijtima.
আগে আস্তের মাঠে অনেক কাদা ছিল, পায়খানা প্রস্রাব করতে খুব কষ্ট ছিল। আমরা অজু করতাম ওই নদীর, গোসল করতাম নদীর। অনামের পানির পাম্প হয়েছে, অজু করতে গোসল করতে আমার অনেক সুবিধাজনক হয়েছে।
Public awareness among people is essential together with supplying safe water and sanitation facilities. Hence, since the 90s, Department of Public Health Engineering initiated innumerable public awareness campaigns to make the safe water supply and sanitation more sustainable. Social mobilization on sanitation project has become successful in creating and increasing awareness, demand creation and social marketing with the help of local government institutions, development partners and NGOs. Tea stall meetings, backyard meetings, school programs, cultural programs and celebration of different national and international events like World Water Day, National Sanitation Month, World Hand Washing Day have created awareness among people at districts, upazilas and villages. To achieve Vision 2021, Department of Public Health Engineering has been working tirelessly and providing numerous trainings to increase the skill of the employees of the department. Departmental innovation team is working to provide better services to the people of the country. To establish proper accountability and transparency, DPHE practices electronic tendering, EGP for procurement, e-filing for providing prompt services, and MIS GIS unit works for digital database management. The government has achieved Millennium Development Goal regarding supplying safe drinking water and sanitation. Now is the time to achieve Sustainable Development Goal through attaining Vision 2021 and 2041. And to build a developed Bangladesh, Department of Public Health Engineering will continue to give the best efforts.